Good morning.
Today, in this channel, Mind Your Mind, I'll be speaking on a topic which has been asked by our viewers, non-suicidal self-injury. So what is this non-suicidal self-injury? This is a terminology which is used by psychiatrists to define people who attempt suicide with no intention to die. In fact, this is a very peculiar group of people, and basically what happens is these are people who do cutting themselves, they do their skin picking, skin caring, bruising themselves, stabbing themselves, these sort of things. And why do they do it? They basically do it to reduce their tension, they do it to do self-punishment, that is punish themselves. And in fact, the peculiarity is they do these sort of cuts in hidden areas which are very accessible, say the arm, and they can always close it with their full sleeve shirt, these sort of things. So this non-suicidal self-injury, basically what happens is these are people who should not be ignored. Please understand this. Don't think that, don't give them any idea that you are acting. No. Many times these are people who suffer from various psychiatric disorders. In fact, non-suicidal self-injury is seen in few personalities. Personalities, I mean what is called as the emotionally unstable personality, antisocial personality, histrionic personality. These are people who seek attention by doing these sort of things. And of course, there is what is known as you all know, eating disorders. People with eating disorders try to do this when they are stressed. To relieve their tension, they do this. And of course, even some people with moderate to severe depression, they also do this. So my request is, please try to understand these people. Don't think that they are doing it to just for catching attention. No, many times what has been seen is these are people who have some adverse childhood experiences which make them do this. And of course, these are people who have less emotional support, and they have been criticized often, and they have been subjected to strict parenting in their childhood. So these are the people who do these non-suicidal self-injuries. So basically, what happens is when they do this, parents get worried. Parents get irritated with them. They become hyper-vigilant. And when they become hyper-vigilant, these people, they also get angry. They again try to do these sort of things. So basically, what we have observed is these are the people, many times they can land into problems accidentally. I can give you a case history of a girl. She was working in a government office. She was 19 years. She used to repeatedly do these non-suicidal self-injuries by cutting her hands, and basically she used to land up in our hospital emergency ward. So what happened was every time she used to message me or message her relatives saying that she is going to do this. Then over the years, what happened was people started taking her lightly, and then one or two times she had cuts. She had cuts on her chest, and in one such attempts, she in fact cut a very vital vein in the neck, and in fact we had to admit her, shift her to a higher center, and of course in the higher center also, because the injury was so severe, in fact they tried their best but they could not save her. So why I am telling you this is, see, those people who attempt suicide, please don't think that they are acting. And never be under the impression that this non-suicidal self-injury, this is done by people to, it is sort of a drama. They know that they won't die and they simply do it to attract attention. This is what is the notion among the public. So my earnest request is, please see that they reach a mental health professional. Anybody who is indulging repeatedly in non-suicidal self-injury, he or she has to be subjected to psychiatric evaluation, and the psychiatrist usually comes to a psychiatric diagnosis. Only after the psychiatric diagnosis, probably treatment involves basically counseling, basically trying to find out what makes them what makes them do these sort of things. And also, of course, many a times what we have observed is these people enjoy the blood coming out, enjoy that cut they have done, and of course they also enjoy the reaction from the people around them. So this makes them to attempt repeatedly. So basically counseling involves teaching them alternative methods of coping, teaching them self-compassion, teaching them that it is not these injuries which should relieve stress, but what are the other stress relieving mechanisms, what are the stress releasing coping mechanisms they can learn. And in fact, we subject them to intensive psychological counseling, and after that they are taught problem solving skills. They are even taught relaxation exercises when that stress and urge to do these non-suicidal self-injuries. We teach them methods to stop doing these sort of things or postpone that urge. And of course, many a times we put them on antidepressants. And of course, family education is a must in these sort of cases, because, as I told you, many times family gives them, many a times it will be two ways. One is family giving too much of attention. Another is family neglecting them, family telling them that they are acting, they are malingering. I have seen even professionals telling me that this particular person has come to our emergency ward many times and he or she is just acting. No, because why I am telling you this is, if the notions like this are shared among professionals, I can imagine other people. So I urge you to take this non-suicidal self-injury very seriously, and these sort of people need psychological attention. We need to find out the reasons for these injuries and also train them, treat them properly so that they use alternative coping mechanisms. So this is a small video on non-suicidal self-injury. This is a joint project of One Good Step, a NGO which is working in the field of health and education, and A.V. Badiga Memorial Hospital, a hospital which is working in the field of health, creating awareness in the field of mental health. So we request you to please subscribe our channel Mind Your Mind, and we request you to also participate in guiding us what are the programs you want. And in fact, I am thankful to this viewer who has been persistently asking us to do this particular program on non-suicidal self-injury. I hope we have cleared the viewer's doubt, and in future also we will be there to clear any doubts you have. But please understand that this is not an alternative for psychiatric consultation. Always make it a point, if you are feeling dull, you have decreased sleep, you have decreased appetite, you feel that you need to consult somebody, please take help of a psychiatrist or a clinical psychologist or a psychiatric social work consultant. Thank you. Jai Hind.